It's 2 o'clock. I'm Olive Martini, and you have tuned in to KSQM for the Working on Wellness Radio Forum that happens on the second Tuesday of every month. And my guest today is Dr. Nathan Gelder. He's my dentist, and I'm so happy that you're here. Dr. Gelder always strives to achieve the highest level of care and takes time to make sure his patients are comfortable and well informed. In this forum, Dr. Gelder will discuss the kinds of care now available in today's world of dentistry, and he'll answer the most asked question about current oral care and address the most common problems and concerns of today's dental patients. So I always say I love the dentist because they don't weigh you there. And
that's true.
That's the best part about going to the dentist. And I have to start us off. I have a friend whose son hated the dentist, and she was driving him to the dentist, and he was complaining bitterly, and she said, going to the dentist is a piece of cake. It's not like you're going to have to get a root canal. And of course, they get there, and he had to have a root canal. So my first question to you is, what is a root canal?
Sure. Well, it comes up a lot, and it's probably one of the most dreaded things out there, dental procedures. But all teeth have nerves and blood vessels in them, and they were necessary for the formation of the tooth. But once the tooth is fully formed, you don't need them anymore. And for various reasons, most commonly a deep cavity, but also cracks and different things, the nerve can become infected and very painful and needs to be removed. So all a root canal really is it's just a really deep filling where you drill all the way down into the root and remove the nerve and then fill it in. And the tooth stays, but it no longer has a nerve in it.
Okay.
Yeah. But I think they have a really bad reputation because oftentimes when people are needing a root canal, they're in a lot of pain. And that really sticks. Whereas the actual procedure is not a whole lot different than anything else. You get numb and open wide, and we do our thing.
Okay. You don't do laughing gas anymore.
We do have it available.
Oh, really?
Yeah. Yeah. You have to request it next time, huh?
Okay, well, maybe. And as we were talking when you first got here, this is the first time I've seen you without your mask.
Yeah. It's a lot of time. First time we're seeing a lot of people without masks.
I know.
For the last few years, huh?
I know. Well, you're the dentist, so you're
and I've always had them on, even before COVID.
I had no idea my dentist was so handsome. So what is an implant and why so expensive?
So an implant is just definitely becoming one of the most common ways to replace teeth. They've been around for 40, 50 years, but have become a lot more common in the last 10 to 20. And essentially, it's just a titanium screw that is placed in the jawbone in the position where the tooth used to be. And then we make a crown or a cap, just like we do for teeth, that fits onto the screw instead of the tooth. And they work really well. They're the closest thing we have to an actual tooth replacement. They don't affect the teeth on either side, which is a problem with like bridges and things like that. As far as the cost, everything in dentistry is expensive. And, implants in particular have a lot of custom parts that need to be made and ordered from the company. And that's the only place you can get them. They're all milled out of titanium, and they are incredibly expensive.
So what if you have several teeth that need to be replaced? How many can you do?
Yeah. So, if you're just replacing one tooth or two teeth, it's usually just one implant, one tooth. But if you're missing, say, an entire arch, top or bottom, it's becoming more common to actually place an entire arch of teeth, all connected, on 4 implants. So
you could do
4
everything?
Implants on the top or 4 implants on the bottom, and then you put an entire row of teeth on those 4. And then if somebody's missing less than that, say you're missing 3 or 4 teeth in a row, you could do an implant like on one end of the missing teeth and the other end, and then do a bridge that's connected to the implants instead of the teeth.
So does that happen from like periodontal disease that you lose teeth that way and that you can replace?
One reason, but periodontal disease, decay, trauma. Those are probably the 3 main reasons why people lose teeth.
Okay.
Yeah.
And so what's tartar?
Tartar is it's just another word for what we call calculus. And so speaking of periodontal disease, that's kind of the main reason why people end up getting gum disease is a buildup of tartar on the teeth. So tartar or calculus is essentially you get plaque that builds up in your teeth every day. It's like slime. It comes off really easily. But if it's left on long enough, the minerals in your saliva will actually harden it like cement. And then you can't clean it off. And you actually have to scrape it off with the tools that like the hygienist will use. But once that forms a little ledge of like cement on the side of the tooth, it harbors bacteria. And it's usually right at the gum line. And so the gums get really inflamed and irritated. That irritation moves deeper to the bone. And then the body's response to try to deal with that is to get away.
Okay.
And so the body retreats. It means the gums recede. The bone actually starts breaking down and trying to get away from that tartar buildup. But of course, you're losing the support of the tooth.
So what I noticed during the exam is that you take a tool and you're checking to see the recession of gums, and you're using numbers.
Lots of measurements. All those numbers it's just millimeters.
And so what does that mean when you hear 3, 2, 1?
So the most common thing that we're measuring at your cleaning appointment is what we call the gum pocket depth. And so that's the gum where you actually see the gum to where it attaches to the root of the tooth. And 2 to 3 millimeters is considered normal and healthy. A toothbrush, floss, water picks can get down 2 to 3 millimeters really easily and clean that area. Once you get a little deeper than that, you can't clean as well. So then there's bacteria down there that are just there all the time that you cannot clean out. So 4 millimeters, not so bad. 5 and up is when we really start getting worried because you can't clean that deep. And again, you get that situation to where the bacteria is always there, always causing irritation. You can't clean it. So it just starts breaking things down slowly, bit by bit. The hygienist at a normal cleaning can get down 5 or 6 millimeters relatively well and clean. But then there's situations where when they start getting in the 7s and 8s and up, that's just a situation that's getting worse and worse and needs something beyond a cleaning.
Okay. It's 11 minutes past 2, and this is the Working on Wellness Radio Forum. I'm Olive Martini, and my guest today is Dr. Nathan Gelder, DMD, and he is my dentist. And we started up right off talking about teeth, Dr. Gelder, but tell us a little bit about you and your background, how long you've been practicing.
Yeah, sure. So I have been a dentist for just over 20 years, which sounds weird even saying that. I don't feel like I should be that old. But I grew up in Oregon, went to dental school at Oregon Health Sciences University in Portland. Then have been here in SCWM. I got a deal, a scholarship with the Navy. And so they paid for all my school. And then I worked for them for 4 years and spent a year in California and 3 years in Japan. And that was a really great experience. That was a lot of fun. And then moved to SCWM actually from Japan. And so have been here for 17 years. Yeah.
Very good. You're almost a pioneer.
Almost.
So we were talking about, while we were off there, we were talking a little bit about how the technology in caring for teeth has changed so much. Since you've started and now, what's different about what is happening in dental care?
Well, there's been a ton of changes for sure. I mean, in the last 20 years since I've been in dentistry, I wouldn't say there's been a lot of major changes. We were just talking about implants before the song, and implants are certainly much more prevalent. And there's been some minor changes in kind of the design of implants, making them just a little more successful in things. Nothing major, but they're definitely becoming just way more common. It used 20-some years ago, it was kind of a little more of a rare thing. Now they're being done all the time. Used to be definitely considered more of a specialty thing that you went to a specialist for. And now I would say the majority probably of general dentists are very comfortable doing implants. So that's one change for sure.
Yeah. So I kind of lost track of what
Yeah.
I wanted to ask you next.
Sure.
We talk about, some people don't like the dentist because it's painful. What would you say is the most difficult part of a procedure when you go to the dentist? I used to hate the X-rays, the bite wings.
Right.
Talk a little bit about those.
Yeah, well, so one thing, I mean, as far as technology and changes, X-rays have changed quite a bit because almost everybody, I think, these days is using digital X-rays, and that's been a big change. When I first started, they existed. They certainly weren't nearly as good as they are now, but it was definitely more of a rare thing to have digital. Most of it was still film-based. And so the digital sensors have gotten way better to where they use a lot less radiation. So you're getting a quarter or less, I think, of the radiation.
And they're a
for
lot
X-rays.
smaller.
Yeah, and so the old film, kind of cardboard style ones, had a lot of sharp edges.
Yes.
And the sensors, I wouldn't say they're a lot smaller, but they're much more soft and rounded and comfortable. They're not going to poke into the gums and get you like those old cardboard ones would.
Yeah, I know. I used to think that was the worst thing. Tell us about tooth grinding. Why do people grind their teeth? And is it harmful?
Well, people grind their teeth for all sorts of reasons. Stress is probably a big one. Just a habit of clenching or grinding your teeth. And, if it's during the daytime, I mean, and is it harmful? Yes, it is. It really leads to a lot of wear on the teeth. Also cracks, as well as just the whole jaw musculature assembly just getting really sore and tired all the time. But yeah, during the day, just trying to break that habit like any other habit. The thing is, most of the grinding that occurs is at nighttime, and that's a lot harder to do anything about because you're asleep.
Do you suggest I'm making
a guard.
A night guard.
Yeah, exactly. That's what we were kind of getting to. But yeah, that's definitely the most common thing because there's nothing you can really do significantly to stop that. So making a guard that you wear in your teeth that goes in between the teeth, and that way, a lot of times, most people have this position where when they close their teeth together, they just kind of fit. And what often happens is you go through these different sleep cycles at night, and grinding is normal. Everyone, I would say, grinds their teeth to some degree at night, but most of the time it's just a few seconds here and there, in and out of different cycles of sleep. Some people, though, it can be hours and really hard grinding in and out of that position where things just kind of fit. And so you put that guard in, and your body loses that feel, that position, and a lot of times the grinding can just stop.
And you can just tell that when someone comes in to get their teeth cleaned that they've been grinding. You can tell that.
Oh, I mean, if it's been long term, then you can certainly see it on the teeth. Mm-hmm. Teeth have all these bumps and ridges and grooves, and a lot of times, I mean, in extreme cases, those can be completely worn off, and they're just flat. And occasionally, if somebody's really had a grinding habit for several decades, their front teeth might be half the height of a normal person's front teeth. They just get worn off. Yeah. So yeah, night guards can be really helpful, and at sometimes stopping the grinding altogether, but at least if you're still grinding, you're grinding on plastic and not on your tooth.
Okay. Wisdom teeth.
Oh yeah, people always like to talk about wisdom teeth.
So do they always need to be extracted, or talk a little bit about that?
Yeah. No, not always. In fact, the main reason people get their wisdom teeth out is just because there's not enough room in most people's mouth for them to come in completely and correctly. So they'll often come in just part way. They'll get stuck about halfway in and create a situation to where they're really difficult to clean. And then germs, food will get stuck in and around the gums, and it'll lead to infections and problems. And so that's why most people get their wisdom teeth out. Occasionally, either someone has a large enough jaw to where they fully come in, and then there's just another set of teeth, or if they've sometimes lost some teeth, either for one reason or another, often braces. Some people will have, kids will have teeth pulled, the rest of the teeth kind of scooted forward, and then they've got room. And so if that's the case, then they just stay, and they're just a normal set of teeth to chew with.
Okay.
But yeah, wisdom teeth, removal is something everybody always dreads, and you hear all these stories. And nowadays on YouTube, you see all the videos of, people acting crazy after getting the wisdom teeth out and that sort of thing. But
how soon do you want to see someone come in, a child? At what age do you want to start seeing them at the dentist? If they've got teeth that are coming in crooked, or they're still developing their adult teeth, how soon do you want to see them?
I usually say about 2 years old is a good time just to kind of start checking on things and seeing, how things are doing. At that age, you're usually just talking to the parents and answering questions. Rarely are you going to see anything really wrong, although you can start seeing the beginnings of some decay at that age, and then you can certainly start talking to the parents about improved hygiene and that sort of thing. But yeah, I think that's a general rule. And for the first couple, if we're doing a yearly visit starting around that age, the first time or two, it's just going to be looking and talking to the parents. And then most kids around 4 or so are going to let you start maybe cleaning the teeth, maybe taking that first set of x-rays, that sort of thing.
Interesting.
Yeah.
I don't think I was that young when I went to the dentist. I'm Olive Martini, and this is the Working on Wellness Radio Forum. If you're just joining us, we do this the second Wednesday of every month. And my guest today is Dr. Nathan Gelder, and we're talking all about teeth. And last time we before the music, we were talking about children and how soon they should come in and see the dentist. And tell us a little more about that. How you handle children and their needs.
Yeah, we were just talking right before the break about how, around 2 years old or so was a good first visit, and a lot of times more for the parents, just to kind of educate on what should or shouldn't be happening, and just kind of get the kid used to what going to the dentist is like. Make it a good experience is the goal.
They don't weigh you there.
They don't weigh you. That's right. And yeah, just make it good. If a kid's first visit to the dentist is an awful experience, that's going to stick with them, and we want it to be good. So We're hoping to not find anything that's needed to be done, and can just kind of make it a fun experience. And that's happening, more and more these days. Kids now are growing up in an era where fluoride is very prevalent. It's in a lot of community water sources. Even if you're not in a community that's fluoridated, it's in virtually all toothpastes. It's in so many products that are bottled. Bottled water, a lot of the times, has fluoride in it, depending on where it was bottled. Juice, soda even, depending on if it was bottled in a community that's fluoridated, which most big cities are, it likely has fluoride in it too. So kids are getting it from all sources, and because of that exposure to it at a young age, it's actually incorporating into the enamel of their teeth and making the teeth much more resistant to decay.
And talk a little bit about cavities and sugar.
Yeah, right. Well, sure. So, that's kind of the, what most people think about when they think about the dentist, and what we're doing is fixing cavities. And that is, a big part of what we do. As far as how that happens, it's sugar or any carbohydrate that easily breaks down to sugar in the mouth. The bacteria, some bacteria, not all. There's a lot of bacteria that live in the mouth that don't cause decay. And those are great. If your mouth is populated with those bacteria, then even if you are having a little more sugar than you should, you're likely not going to be that prone to decay. But there are certain types of bacteria that absolutely convert that sugar into acid, and that acid breaks the tooth down. And so if you've got a population of those bacteria and you're eating too much sugar and not keeping up on your hygiene, it can happen quick.
Well, talk a little bit about acidic foods like lemons.
Yeah. And so acid from foods can certainly cause problems. It's not going to cause decay in the same way that the bacteria do, but it's definitely going to break down the enamel. And we talked earlier in the show a bit about grinding and how that leads to a lot of wear of the teeth. And acid will kind of do the same thing, except instead of a physical erosion of the biting surfaces, it's a chemical erosion. And oftentimes it's more at the gum line, but it will actually, start eating away at the teeth if you're eating a lot of acidic food.
Tell us why we should replace missing teeth.
Sure. Well, I would say probably the most important or common reason to replace missing teeth is just because you want to replace them, either for appearance or for chewing function.
They'll move, right? If you don't.
But yeah, that's another issue. If teeth kind of stay more or less where they're supposed to be, because they kind of hold each other in place to some degree. So yeah, if you've got a missing tooth or two, and you don't replace it, it's really common for the teeth behind to actually tip into that space. The teeth opposing those will actually erupt kind of into that space, and things can just get kind of out of alignment. That certainly can lead to problems chewing. Things just don't come together quite right. And then if you decide you want to replace them down the road, it becomes much more complicated because you don't have that space anymore that you used to have that the tooth occupied. And so, yeah, getting teeth replaced relatively soon after they're taken out, certainly the best thing to do. And, there's multiple ways of doing it. Obviously, I think for a lot of people, cost is a factor in replacing missing teeth. And having teeth replaced permanently through an implant or a permanent bridge is great. And that's kind of often the goal. But if that's too expensive at the time, there are other options. There's removable appliances that actually go in and out of the mouth that are much less expensive and will still do a good job of holding that space open.
Okay.
So that, you've got them replaced at least temporarily. And then if you want to do something more permanent in the future, you're all set. Yeah.
Tell us a little bit about dry mouth causes. Is it harmful?
Yeah, well, so, we were talking earlier about decay and kind of the causes of that. One of the major preventers we have of decay is just our body's natural saliva production. Our teeth are constantly being washed by saliva in our mouth. And as that dries up, they don't get washed like they should. And when we see dry mouth, we see a huge increase in the prevalence of tooth decay. And the most common reason for dry mouth for most people is medication related. So, a lot of times as you get older, you get prescribed other medications for various reasons. A lot of times good reasons that you should be taking them. But if you look at the side effects of almost any medication, dry mouth is on there. And some cause it a lot more than others. I need to take a drink right now after talking about it.
So drink lots of water.
Yeah, and drinking water absolutely is one thing you can do. I mean, that's the easiest thing to do is if you're taking medication that you know is causing dry mouth, or if you've just noticed your mouth is drier. Salivary glands do tend to produce less as a person gets older. So that's an issue. Radiation, if you've had any kind of like head or neck radiation for cancer issues, that can dry up salivary glands. But yeah, if you notice your mouth getting dry, just having a water bottle on hand and taking little sips every now and then absolutely will help. And then there's other products you can get at the pharmacy. There's products actually called artificial saliva, which sounds a little weird, but they're just gels that kind of stick with you a little longer than a drink of water would and just moisten the mouth.
Okay.
So, yeah.
Tell us a little bit. You were speaking while we were listening to the senior report. You were talking about when people have hip replacements, knee replacements, and they make their appointment with the dentist. Give our listeners a little information on what they need to know.
Sure. Yeah, we were talking on the break a little bit about just kind of how things have changed. And we were kind of at the beginning of the show talking a little more about what's changed in my relatively short career. And that has been a big one. So for the longest time, orthopedic surgeons and the Dental Association have done studies and determined that artificial joints are at a much higher risk for bacterial infection. And after you have dental work done, oftentimes you will get bacteria that is introduced into the bloodstream. Now, for most people with a healthy immune system, it's not a problem. A little bit of bacteria gets into your bloodstream, your immune system takes care of it, kills it off immediately. It doesn't cause a problem. But with artificial joints, they're much more susceptible to infection. So that little bit of bacteria gets into the bloodstream, and it can actually colonize the artificial joints. And that's been an issue and a known issue for quite a while. The thing that's really changed in the last 5 to 10 years is the prevalence of artificial joints. They are being done at just a many-fold increase over what they were just even 10 years ago. Not only do they want you to take antibiotics before dental treatment after an artificial joint to help prevent bacteria from colonizing them, but they also want to make sure that before you get the artificial joint that you have no infection in your mouth, because that could be putting bacteria into your bloodstream, at least even on a small level, again, that your body is handling fine on the day-to-day, but they're worried that when they go in and do the surgery that the joint could become infected. And so they actually will require people to come in and have a dentist evaluation before the surgery to make sure that everything's healthy and infection-free before the hip or knee or whatever joint it is surgery.
Talk about the kinds of things that a dentist will see happening with a patient before a doctor can.
Well, there definitely are some things, as far as systemic health that we have a pretty good, ability to see ahead of time. We talked earlier in the show a bit about gum disease. And gum disease and diabetes are linked very closely. One causes the other and leads to the other, and vice versa. And so if we see somebody who has really severe gum disease, it can be a real big clue that there is some diabetes issues going on as well, either pre-diabetes or actual diabetes. And if they not have that checked, it's not uncommon for us to see pretty severe periodontal disease, more than you would expect for other reasons. And we'll say, hey, have you been to see your primary care person lately? And a lot of times the answer is no. And maybe you should go get things checked. And they come back and they're like, oh yeah, they are pre-diabetic, or maybe they already even have diabetes, type 2. Hopefully that could just be still controlled with diet and things. But and then they get their diabetes under control, their gums start looking better. We go in and take care of the gums and get things looking better there, and then the doctor's telling them their diabetes numbers are looking better. So that is one area where dentistry and medicine certainly go hand in hand for sure.
Okay.
Yeah.
So sugar, the real cause of tooth decay. We can talk about it some more. You talked a little bit about how dry mouth and acid and bacteria can all cause these things.
Yeah, they can. And, decay, it's a balance. In any person's mouth, there's always a little bit of breakdown, decalcification of the tooth. And a cavity is just extreme decalcification. And then there's recalcification. Your saliva is full of calcium and phosphorus and magnesium and all these things that teeth are made out of. And by bathing the teeth in the saliva, they re-mineralize. You think of teeth almost like a sponge. They're losing a little bit, but then they're gaining a little bit back. And hopefully, for most people, that process is kind of in balance. You eat a meal, you have a little bit of sugar, and for 15, 20, 30 minutes later, the teeth are decalcifying. But then you brush, ideally, or rinse, or the sugars just kind of dissipate, and things remineralize. And that's great. But then when things get out of balance, when the decalcification portion starts happening more often than the recalcification, that's when things start getting out of whack, and we have to get in there and do something about it. So sugar being the real cause. I mean, sugar is certainly part of the cause. Yeah, but it's obviously multifactorial.
Brush your teeth after every meal. Brush your teeth twice a day.
I would say ideally, brushing your teeth after a meal, sure, great. Twice a day for most people is plenty.
Yeah.
If you get in there and floss once a day, brush twice a day, most people are going to be in good shape.
Tell us a little bit about what happens. Okay, your child is playing a sport, and a tooth gets knocked out. What's the best thing to do right away?
Well, so if you know for sure if it's a baby tooth versus an adult tooth.
This is an adult tooth.
Okay, that matters because if it's a baby tooth, you don't really do anything.
Okay.
Because, well, and so getting back to it, it actually is possible if a tooth is put back in the socket right away, that it actually can reintegrate back to the bone. But it does so oftentimes in a little bit of a different way, to where if it was a baby tooth and you put it back in and it integrated back in, it might not be able to be lost when it needs to be.
Oh.
So that's why that's important.
How much is the tooth fairy getting these days?
It's gone up tremendously.
I've heard that.
I
used to be like a dime.
I hear kids $5 a tooth.
Really?
$10. Oh yeah. I'm shocked. I was like, wow, that's gone up significantly.
Gosh, it's good to be a kid these days.
It is. Yeah. So I often, with the tooth fairy, I'll give kids a little, sometimes kind of a little math question sometimes. And so I tell them, you've got 20 teeth. And if you've got a choice, you can either have $100 per tooth, or you can have $1 for the first one, $2 for the second, $4 for the third. It doubles every time. Which would you rather do? And most of the time, the kids just jump on the $100. They want it, but some of them really think about it and start seeing that increasing. And actually, so if you do the math on that, it actually comes to $1 million when you start at $1.
So then you can afford.
But I think even if that's your choice, I don't know if the tooth fairy is going to come through on that. But
well, that's funny.
Yeah. But getting back to the tooth loss thing, ideally, if you can just get that tooth actually back in the socket as soon as possible, that's the best thing to do. If you're uncomfortable or uncertain about it, how to put it in or wanting to make sure it's the right tooth, it's not a baby tooth, any questions at all, and wanting to, have a dentist kind of give you some guidance. The best way you want to keep them wet and moist. If they dry out, then they're not going to be able to go back in usually at all. But if you keep them wet, and so there's a couple different there's solutions made in first aid kits sometimes that you can put a tooth in if you happen to have one of those. Milk is supposed to be a real good one. It keeps the tooth hydrated properly with the right minerals and all. But then another one is actually the parent can actually just put it in their own mouth.
Okay.
Yeah. So if that doesn't gross you out too much, you can just put it in your own mouth and just kind of suck on it like a lozenge, and it's going to keep it perfectly hydrated until you go see the dentist. And then they can take a look, and because not only does it need to be put back in the socket, but usually it needs to be stabilized a bit as well. Kind of a little bit of temporary glue or something that'll kind of help hold it into place. Yeah. So
how many emergency calls do you get where it's kind of like, I broke a tooth, I'm on stage in 2 hours, what do I do?
Yeah, it happens. I mean, not as often as I guess I thought it might. Here in Sequim, we don't have quite the number of kids, getting in accidents as some communities. But yeah, absolutely, teeth break. And sometimes, you have to, try to make things happen relatively quickly. Get in there and try to do a little emergency fix up. Yeah, so it happens, but I wouldn't say it's terribly common.
Let's talk a little bit about the free clinic, because the free clinic puts on the Working on Wellness Radio Forum every month, the second Tuesday of the month from 2 to 3. And the Dungeness Valley Health and Wellness Clinic is one of 32 free clinics in the state of Washington. And Dr. Gelder, tell us a little bit about the free clinic's dental voucher program.
Sure. Yeah, they've been doing it for a long time, and it's a really great thing to have for the community. You can, I don't know the exact procedure, but you can call them and go be seen during their hours and be evaluated. And if they determine you have an oral issue, they will issue a voucher. I think it's about $250 right now, but it's accepted at, I think, most of the dental offices in Sequim. Several for sure.
There's 6 of them, and you're
6
one.
Total. I'm one of them.
Yeah.
Yeah, and and it's enough to at least be seen and evaluated, and usually have maybe a tooth pulled or filled, or at least one issue kind of addressed, and so it's a great program, just to kind of help people get their foot in the door and get something taken care of. But usually and they kind of tell people this is for one issue, so unfortunately people have accumulated multiple issues. At least it's a start, but it's a great thing to have for the community for sure.
As we tell our listeners, if you're new to the area, you haven't found a doctor yet, the free clinic is available to you. The Dungeness Valley Wellness Clinic, SQUIM's free clinic, provides basic urgent care and chronic health care services to uninsured community members. And they are open on
Monday and Thursday
at 4:30. And Dr. Gelder is one of the dentists that helps out the free clinic with these dental vouchers. And so the one thing that we can tell people, if you're new to the area, make sure that you call around, because dentists and hygienists are a little bit short here on the peninsula right now. And hopefully next year there'll be new programs that are getting more hygienists out there.
Yeah, we were just talking about that. Peninsula College used to have a hygiene program. It got shut down about 10 years ago, I think. But they are in the process of starting it again. I think their first class they're hoping to start next year. So in several years, we're going to have a new crop of hygienists being produced for us right here on the peninsula, which will be great, because there really is a shortage, just like we were saying. And yeah, if you're new to the area and looking for a dentist, it can be a challenge, but keep trying. Call around. A lot of offices will have waiting lists. And hopefully we can get in and get things done. I know my office, and I think a lot of offices are kind of in the same position. We'll take people on a really limited basis, especially for an emergency. Like if you break a tooth or you're in pain, we can usually get you in and take care of that. But getting in on a regular basis to get regular cleanings, it can take a while. But usually if you're persistent and call around enough, it can happen. But like I said, with that new hygiene program, we're really hoping that will change things coming up here soon.
So the best thing you can do is drink lots of water.
That certainly can't hurt.
Brush your teeth twice a day and floss at least once.
That will go a long ways for a lot of people.
Yeah, hang on to your teeth.
Yep.
Okay. Well, let's talk about another 2 minutes.
Okay.
2 more minutes. Tell me something I don't know.
Oh boy, something you don't know, huh?
You're my dentist. What don't I know?
We've covered a lot. I'm trying to think. We were talking. Well, earlier we were talking a bit about new technology in dentistry. Something we didn't get around to talking about, but is certainly new, are lasers in dentistry. And they're certainly starting to be used for certain things. One really promising treatment with lasers is getting back to gum disease that we were talking about as well. Treating gum disease with lasers. That's something that's shown a lot of promise, to where that gum and bone connection to the tooth that's been lost can actually be rebuilt. Which for a long time was thought wasn't possible. Once it happened, your goal was to just try to stop it.
So like if you have an exposed nerve that when you go to
like
the
an
dentist,
exposed
it's kind of
root
like,
that's kind of sensitive.
Owie?
Yeah.
Yeah.
So that can be fixed, not so much with a laser, but with a gum graft. They can actually take gum tissue off other spots of your body, usually the roof of the mouth, and actually put it over the root there and cover it up. So that can be done. If you have a real sensitive root, cover that gum back up again.
Okay.
So, yeah.
Thank you for coming.
Absolutely.
We kind of ran out of time. We're going to play the Pink Panther theme. Come back, please.